Hi, good afternoon, everybody. I'd like to welcome you to today's webinar celebrating 2022's International Myotonic Dystrophy Awareness Day. I'm really honored to be with you all on this incredibly important day, not just in the United States, but across the world as the United States and other countries celebrate and recognize individuals and caregivers and researchers and clinicians who are all in this together in our efforts to improve care and ultimately find treatments and a cure for myotonic dystrophy. We are just coming out of a really amazing first in-person Myotonic Dystrophy Foundation annual meeting in over 3 years. So if any of you on the webinar today were out in San Diego, I think you all probably felt that same really great energy that I did and just having to connect with so many folks, and was also grateful that so many folks were able to participate remotely in that. In the hybrid that we had. So I am speaking to you almost within the shadow of the Capitol here in Washington, D.C. And wanted to share some breaking news with folks before we get started today. We've been on a long journey, sometimes confusing. We've had some stumbles in work that's been ongoing in the United States Senate. And for those of you that may remember, we had announced that around this time in August of last year that Senators Kane from Virginia and Klobuchar from Minnesota, Olympia Snowe, a Republican from Maine, and also Senator Lummis, who is a Republican from Wyoming, and several other senators had gotten together on a bipartisan United States Senate resolution that recognizes September 15th as International Myotonic Dystrophy Awareness Day. So that legislation was introduced last year to great fanfare over the summer. And we were not able at the time to get it over the finish line for a variety of reasons. And I think that while that can be confusing and it's been frustrating for me, particularly in the work that I've been doing on behalf of the foundation, it's taught us a lot about the importance of our staying engaged with our policymakers in Congress and in the administration to continue the fight, to build awareness of this rare genetic disorder and to increase the number of folks who join us in Congress to help us in our work to try to improve the lives of individuals living with myotonic dystrophy. So in that journey, we are at a point today where a new resolution recognizing 2022 has been reintroduced or is about to be reintroduced in the United States Senate today. And I have been in contact, as been several of the volunteers in the organization, with some of the Senate leadership. Once that bill is introduced today, we will be sharing immediately with the community its new Senate resolution number. It'll get designated with a specific number, and we are working with the Senate leadership to schedule what's called a unanimous consent approval within the Senate. So there won't be an actual official floor vote where members are actually queried on the floor as to a yay or a nay or even a present. And then a tallying of the votes. But given the way the Senate operates, they operate under what's called unanimous consent, meaning any one senator out of 100 can raise their hand and object and stop the movement of legislation. So we are seeking the approval of all 100 senators, and we think we'll have that done in the next few days so that they can bring it to the floor for a unanimous consent vote, if you will, and that will make it, that will have it passed. So we'll keep you posted. And we're really excited that we're getting the bill reintroduced today, and we'll keep folks posted on that. So with that breaking news out of the way, wanted to talk about, briefly, that this is an effort across the globe, right? So we're going to be focused today on our efforts on advocacy within the United States, and particularly with our federal representatives here in Washington. But there's a global alliance, as you all know, and there's 55 members that span 15 countries. And you can see some of the logos from some of the institutions and organizations that are united with us in our efforts to advance research, increase funding, increase awareness, shorten the amount of time it takes to achieve a diagnosis, and ultimately get treatments and a cure for myotonic dystrophy. So it's really exciting to be a part of this effort across the world to try to make things better. So just a quick timeline to highlight some of the work that we've been doing. Many folks have seen this if you were at the conference, but just want to give everybody a sense of kind of where we've been on this journey. Okay, And there's things that have happened before even this timeline starts, but I think a significant point to recognize is the work of Kayla Vitek, who we recognize annually at the annual conference, and whose mom, Lisa, who I think is on the call today, provided an award for Emily Jones, who's a member of the National Advocacy Committee, in Kayla's honor. But Kayla did really important work and showed great courage in testifying before Congress on behalf of reauthorization of the Muscular Dystrophy Care Act, otherwise known as the MD Care Act. And at that point in time, you'll see one of the lower bullets here that kind of tracks our research funding for myotonic dystrophy. So in 2014, it was $9 million. I'm going to highlight the fact, and you'll see it along the bottom here, where we have the number for NIH funding, and that's going to be important as we get a little bit longer along this presentation. But you'll notice that it's 9, 9, and then 9 through 2016, and then it starts to track slightly upward in 2017 at 11. It moves to 13, but we've stuck around that sort of steady state. And that's something that we're going to be focused on a lot today in our conversations. But within that, you'll see other highlights where in 2016, the Myotonic Dystrophy Foundation hosted the first ever patient-focused drug development meeting that brought together FDA and leaders from the biotech and pharmaceutical industry to start talking about what are the views of patients, why is that important, and why should industry be focused on developing cures and treatments for myotonic dystrophy. And I think, again, for those who were a part of either in person or virtually the annual meeting conversation in San Diego this past weekend, there were 2 different presentations, and there were, I'd say, at least a dozen companies that presented on data. In some cases, they were preclinical, meaning they were working in mouse models and things of that nature. In other cases, they were actively recruiting for individuals to participate in some of the early phase 1 and even phase 2 clinical trials that they are moving forward with products that they're trying to determine safety and efficacy. But I think that was part of the real excitement in San Diego around the fact that we're now seeing companies, with a path towards FDA, which means those products, after they prove safety and efficacy, will come to market and be available for patients. So I think when you think about the future, you can think about the past and the work that this organization did in 2016, which really did help lay the groundwork for this. 2017, I was talking at the conference to Larry Lord about a day that he and Hunter and I drove to Baltimore, Maryland, to meet with the senior leadership of the Social Security Administration. We and Hunter really did such an amazing job of helping to educate them on why it's so important for them to eliminate some of the barriers to folks who are applying for coverage under the Social Security program. So through that effort, Social Security designated what's called the Compassionate Allowance Program, which helps eliminate some of the barriers in the paperwork that has to be filed in order to prove that somebody is eligible for these benefits. So there are obviously efforts on part of the government to make sure that folks aren't taking advantage of the program and trying to take advantage of those benefits. But in this case, we were able to achieve a major victory, which has been helpful to lots of folks. And then recognizing that we've been stuck in this sort of flat funding at the National Institutes of Health, the organization stepped forward and said, look, there's other research funding programs that we should be seeking eligibility so that we can find other ways to increase basic research in the base of information and science around myotonic dystrophy. So this was the first year that we were able to secure funding through what's called the Department of Defense peer-reviewed medical research program. And through that effort, that successful advocacy effort, we were able to get a $3.1 million increase, if you will, in myotonic dystrophy research funding on top of our NIH funding. Tim Halen from Massachusetts the following year testified before the House Subcommittee on Labor and Health and Human Services. And he did a wonderful job of explaining why research is so important and the need is so real for treatments and cures and care. And that was a fantastic opportunity there to create awareness. And we continue onward in our efforts to create awareness. So you can see there in 2021, I highlighted already the resolution. So moving along, this is a little more detail around some of the work that I talked about, which has more been focused on the PRMRP program. So that is a program in the Senate that has a large body of funding. And then they list several conditions, about 50 to 60, for the past 5 years through the successful grassroots advocacy of the organization. We have touched, you can see at the bottom of the screen here, Senator Tim Kaine, who I mentioned from Virginia, Senator Klobuchar from Minnesota, Senator Lummis, who I mentioned, Republican from Wyoming, Durbin, Illinois, Susan Collins from Maine, and Adam Schiff in the House. So I'm going to get a little bit more in some of the details, but wanted to highlight and thank some of the folks who have been so helpful to us throughout the years. So what do we want to do here? We want to talk about how we can raise our voices to increase federal funding for DM research. So let's start with just a quick little overview of the National Institutes of Health. So the National Institutes of Health is absolutely the largest and preeminent biomedical research funder in the world. So the main campus is in Bethesda. It is just north of Washington, D.C., in the D.C. suburbs. It started out way long time ago in 1887. It traces its origins to the Marine Hospital Service, which is a little known early medical center within the federal government. But over the long history of this organization, it has funded or been engaged with 168 Nobel Prize winners. So it has got an amazing track record of research, support, and advancement. It includes 27 institutes and centers, ranging from child health to neurology to cancer. There's just too many to count, but that's important because we're going to talk about an initiative that's going to bring many of those institutes together in a cooperative trans-NIH effort that is really exciting. They do a lot of intramural research, meaning there are a lot of researchers on campus who are doing clinical research and other basic research that are funded there internally. And there's the bulk of the funding, which goes out to institutions all over the country, ones that we care deeply about, like the University of Rochester and the University of Florida, and Stanford and Baylor, and many others where there is a core of researchers involved in myotonic dystrophy who have been successful in securing peer-reviewed grants to fund their work. This is a federal agency that is appropriated by Congress every year as part of the budget, and that's an area that we're going to focus in on because that's the area we want to influence. So as I mentioned, this is a chart that shows you where we are, but it also gives you some comparables with Duchenne, with just overall muscular dystrophy funding. You can see spinal muscular atrophy, congenital muscular dystrophy. There is a source you'll see at the bottom there, and so there's a web link, hyperlink that you'll be able to access from these slides, and we're going to have some follow-up materials, so you'll be able to go to this specific part of the NIH website, and this is just a snapshot. I would guess there's probably at least 100 conditions and diseases that are listed there. And this was something that was required of Congress. For a long time, this was a sort of opaque process, and there wasn't a tremendous amount of transparency. And Congress really had been driving the NIH to become much more open about, the types of research that they were funding. So that's something that's important to know. The other program that we're deeply interested in, we want to talk about, is the Congressionally Directed Medical Research Program. So that's kind of the umbrella terminology for the program. And within that is the Congressionally Directed Research Program and the Peer-Reviewed Medical Research Program. So the Peer-Reviewed Medical Research Program has helped us achieve a $8.1 million increase over the past 5 years in myotonic dystrophy. So researchers across the country have been successful in applying for grants that have totaled $1.8 million over the last 5 years. We are then looking to be added for a 6th year in a row. I'm going to talk a little bit more about that in a minute. And we've also been working to get into what is called the CDMRP. And that essentially is where you'll have money that is earmarked, or it is specifically set aside only for that topic. So it could be Duchenne, it could be arthritis, it could be myotonic dystrophy. That is a harder program to become a part of, but we're still working hard to try to make that happen this year. But it may be that that's going to require a multi-level effort of work on the part of all of our grassroots advocacies to get that done. But that is definitely an organizational priority. Just historically, this was a program that was started in 1992. It was started by many of the breast cancer groups that were frustrated that they were being efficiently funded at the NIH. And so they went to several senators, including Senator Leahy from Vermont, and asked if there were some other ways to do this. And so they decided to look at a part of the defense research budget and begin to create a program there. This is a program that is never included in the president's budget. It is purely and exclusively done by Congress, and I think it is really the only program of its kind. So this gives you a little bit of a sense of where we've been successful in peer review medical research program funding. So we've been at 1.3, 2.4, 2.3, and we've dipped down in 300. There's a source here where you can do a search. It's not quite as easy to access as the NIH numbers that I just showed you, but the source is there. You just have to play with this a little bit, and I'm going to share you that right now. So if you go to that link when you get it, you're going to see this. This is a snapshot of the top part of this web page. And if you go down there at the very bottom, it'll give you an opportunity to search awards. And what you'll have to do is go in and plug in myotonic dystrophy into the search function, and it should give you all the grants that have been issued. But it's not as user-friendly as the NIH said, unfortunately. But you should be able to navigate it with a little bit of help. So I want to walk you through, I mentioned that we're going to talk about the congressional funding process, just so you all can understand a little bit of how that works. I'm not asking anybody to come away from this webinar today. There'll be no quiz to test your knowledge of the congressional funding process. That's my job, to understand that. And what I then do is, as I know of these milestones that I'll be talking about, I'm making you aware of them so that you know that that might be, as you get more engaged in our grassroots advocacy, where we might coming to you as a community to say, we need to send, a communication to Congress because we know now they're about to act in the following way. And so it's my job to be the guide on that. So the process usually starts in January, and it's when the president comes to Capitol Hill to do the State of the Union. About 2 weeks, 3 weeks after that speech is given, the president will submit to Congress their official budget, which is a huge, huge document. And that submission starts the process, right? So then there's a process where the budget committee then sort of puts together a resolution that lays out, their large parameters around funding. The Department of Defense would get largely, this amount. The Department of Health and Human Services, all of those would get. And then the next part of the process is when the Appropriations Committee steps in. They have gotten their charge from the Budget Committee as to the larger amounts that they can spend, and they drill down. And so they say, okay, the Department of Health and Human Services gets this. We're going to give the NIH this much out of that. We're going to give the FDA this much out of that. The CDC is going to get this much. And so they have a more granular focus on the budget, which is their charge after the Budget Committee does that. That's the time where Tim Halen came and spoke, during that process where the House Appropriations Committee was putting those priorities together. And Tim had a chance to address that subcommittee directly and explain to them as they were putting this budget together why they should be thinking about us in this process. Senate follows the House usually, so their process usually gets started in the summer, in June. But as it's supposed to work in paper, or as you learned in high school, that's largely supposed to be done where the House and Senate have marked up or voted on their versions of the budget, and they sit independent of each other, at the end of July. And then into the fall, over September, again, this is how the textbooks are written. It's not working that way today, unfortunately. But the House and Senate, have conference committees where they work out the differences between those two appropriations bills. And they're supposed to have that done by September 30th, which is when the fiscal year ends and the new one begins. Lately, they're not getting their jobs done in time, so they have to pass, and they'll likely have to do that again this year, what's called a continuing resolution. And that simply keeps the government funded at current year funding levels for a defined period of time. So this year, they will pass a CR that should take them through mid-December. That will give them time to kind of work through the election, which is coming up, and try to find final agreement on a budget that they will then pass in December after the election. So that's a little bit of kind of how that all lays up, so you guys understand a little bit of the process. So then what are our goals this year? As we headed into this year, what are we trying to accomplish and where are we in that process? So as I mentioned, I'm going to start actually at the bottom, or in the middle, sorry. I'm going to start at the fiscal year 2013 U.S. Senate Defense Appropriations Report, okay? That's where we have sought for the 6th year in a row to be included as an eligible condition as part of the PRMRP program. And that's the program that if we're eligible, a researcher who is looking into questions about myotonic dystrophy, they have that in the title or in the program or in the grant, they are then eligible to be considered for funding. If you're not listed in those conditions and diseases, you would not be eligible for funding. The Senate had an unusual process this year, and we were omitted from the report that they issued in late July. So we have been working behind the scenes to correct that omission. And I've been, on behalf of the foundation, having conversations with senior staff in the House and Senate on the Appropriations Committee to work behind the scenes to get their affirmation that they will include us in that final bill that they take up likely in December. But we are asking our advocates, and I'll get to this action item in a minute, to support these efforts through writing to your House and Senate members, urging them to support this effort. As I mentioned, the third bullet, we're also looking to be added as a line item. Our grassroots push is working towards that too, because that also was not achieved in the House and Senate reports that are there. And so those are items that I'm going to get to in a minute, but wanted to highlight that as to where we are. The final piece, sort of saving the good news for last, the House passed version of the Labor and Health and Human Services Appropriations Bill includes language that the Myotonic Dystrophy Foundation authored with the help of really, really smart and wonderful researchers like Eric Wang, who's at the University of Florida, that starts to look at the family of what we call repeat expansion diseases. And why this is so important, and what Eric has talked about to many folks and others on the Scientific Advisory Committee within the foundation. We know a lot more about repeat expansion diseases that include myotonic dystrophy. It includes ALS, a type of ALS, Huntington's. There's several others in that family. The reason why we're learning so much is really being driven by knowledge that we're gaining through what we know about our genes and myotonic dystrophy specifically. So this is an effort to sort of get beyond this flat level of funding within the NIH, but at the same time, most importantly, drive really good science, which we think is being underexplored at the agency. And so I will talk to you in a minute about where that's headed, but that is really, really exciting. All right, so this is what we call congressional report language. And this is the language that was included. You can see the title page to the House-approved Departments of Labor, Health and Human Services, and Related Agencies Appropriations Bill. And so this is the specific language that I'm talking about that Congress authored and included in the bill. And it says, basically, that the committee, in this case, the House Appropriations Committee, recognizes the rapidly emerging science on DNA repeat expansions, which causes over 50 distinct diseases. Myotonic dystrophy, I'm going to run through this kind of quickly, is one of the repeat expansion diseases and has served as a paradigm for a class of diseases caused by repeat instability and toxic RNA. So then it says, due to the recently developed molecular and cell biological tools, a common thread has recently emerged that repeat expansions may underlie multiple neurodegenerative diseases or conditions. And then the two next important points are the committee, again, this is a congressional committee that funds the NIH, encourages the NIH to explore the most effective approaches to support trans NIH. So when I was talking about all of those institutes, right now, a lot of what happens in our research is done at an institute focused on the neurological aspects of disorders. But we all know that myotonic dystrophy, unfortunately, affects executive function. It results in daytime sleepiness. It causes a accelerated aging of bodies from the genetic up in persons who are living with myotonic dystrophy. It affects the heart. So there's multiple agencies that could be engaged, or institutes within the NIH that could be engaged, and up to now have not been engaged, have not been seen as attractive sources of funding. So we're looking to use this language, which Congress is now directing the NIH to look at this as a trans NIH effort, which is significantly important. And then finally, The committee isn't just putting this out there and saying, good luck NIH, do this. It's saying we request an update from NIH as part of next year's budget as to where you are in this process. So where we are in the process is now that Congress, we're about to move into the new fiscal year that this language is directly focused on. We are going to be meeting with institute directors in the next few weeks to talk to them about where we propose that they have new funding specifically focused on myotonic dystrophy research. And where we want our grassroots advocates to be ready and engaged is we will be working with members of Congress on a letter from Congress to the NIH, reminding them of this language and how important it is that they see this initiative get launched. So there will be an opportunity in the next few weeks that you'll be hearing from us, where we'll be asking you to reach out to your members of Congress to ask them to co-sign that letter. So more to come on that, and I'm certainly probably lots of questions about that, pardon me, that we'll be able to answer when we get to the Q&A in the end, but wanted to highlight some of the excitement that's happening there. But for the leadership of the Myotonic Dystrophy Foundation, this language would not be in this bill, and it's a great victory for all of you who have been involved in this. So getting back to the PRMRP piece. So this is the, you'll see here a copy of the Senate report, which we're in. This is just sort of a timeline as to where we're going, and I've talked about this of the continuing resolution and the omnibus appropriations bill. But what's important here to know is that we have time between now and December to get ourselves back into PRMRP and even advocate for inclusion in CDMRP. But the main priority here is making sure that we fix that omission so that we can continue on the 6th year of funding for PRMRP. All right, so where are you in all of this? Well, we want you to be deeply involved. So I'm a bit of a history buff, so I always like to find great historical photos that we can use. And so for those of you that know, this is Uncle Sam. And in fact, Uncle Sam, I think was, I believe anybody who's in the call from New York, the origin story here is just around Albany, New York, where this image actually first came to be. But we want you to be involved. And why this is important is, you know, members of Congress just don't wake up in the morning and say, oh, I know that there are people who get myotonic dystrophy. You know, it's up to us to educate them on what it's like to live with myotonic dystrophy, what it's like to care for somebody with myotonic dystrophy, and why it's so urgent that Congress join us in this effort to find a cure. So how do you get started? You know, many of you may say, okay, I know who my senators are and I know who my representative is. But if you don't, how do you get started? So the simple answer is to go to congress.gov. And again, we've tried to put the hyperlinks at the bottom of some of these slides so you can go and find them. But we wanted to provide some screenshots just so folks could kind of get an understanding of where this is. So if you go here now, on the very right-hand side in the bottom here, you'll see in a black box, it says contact your member. So if you put in your zip code, your street address, and your zip code and hit there, it's going to pop up next screen. So what I did is I put my parents' address in Baltimore, Maryland here. So that's why it pops up with Senator Cardin and Senator Van Hollen. And in between them, you'll see Representative Kwesi Mfume. Okay, so he's their House member. In many cases, you might get multiple House members. Some of these districts get, you know, with computer technology these days, get drawn so tightly that, you know, as on one side of Hickory Meadow Road in Hunt Valley, Maryland, where my parents have lived, you may represent one, you know, member of Congress. On the other side of that street, it may be somebody else. So it might take a little bit of sleuthing to get to that, but you'll get there. But that's just so you're aware. So then I picked, you know, Senator Van Hollen to go next here. And Van Hollen's page pops up next when you click on that. And you'll see here it has his website listed. And then you've got his office building, where it is, the phone number, list party, just gives you a little bit more detail. So that's, you know, kind of where I'm sending you down this path here. We're going to start with just understanding, you know, the senator. So that then takes you to the front page of Senator Van Hollen's actual web page. And it used to be in the sort of advent of the internet that you were able to sort of directly use an email address and directly communicate through email and send your messages to your representative, your member of Congress in the House, and your senators. And like many things with the internet, there became some problems with that. And members of Congress were getting a lot of communications for folks who didn't live in their congressional district or didn't even live in their state. And so given that they have limited resources, they try to, they prioritize communicating either with their, constituents who live in their congressional district, or if they're a senator who live in their state. So their way of trying to sort of narrow that down and ensure that they're trying only primarily communicating with those folks is you have to communicate with them through their website. So if you see on the very top bar there, you've got about, constituent services, issues, news, contact, investing in Maryland, because he represents Maryland, but you want to go to the contact button. So if you click on that, you're going to see a couple of things. The first thing you're going to see is, how do I email Senator Van Hollen? So this is a pretty basic form. It'll be a little different depending on, what member you're, what senator's office you're contacting, but in general, this is a pretty good sample, right? So you're going to have, your name, first name, last name, your contact information. Again, they want to understand, are you from their congressional district? Are you from their state? And then below that, you'll see, I wasn't able to capture all of this. There'll be a text box where you can put in your story, which we're going to get to. But there's also an opportunity to request a meeting. And so we're trying to encourage folks to really use whatever form of communication you want. You might be most comfortable just making a quick phone call. So you can use their phone number and you can leave a message, or you can talk to somebody in their office about the issue if that's what you prefer. You can send an email, which we just showed you, or if you're ready for sort of the advanced level of engagement with members of Congress, you could request a meeting. You can start with requesting a meeting with them. If they're busy or they're not able to do it within the time frame that you've laid out, most likely then you'll be handed off to their leading healthcare person who will talk to you about these issues. So you can see that you can request a meeting in Washington, D.C. if you're traveling here. For Van Hollen's constituents, it's not too terribly hard because Maryland is just above D.C. But if you're further away, you may want to say, I'm not going to be in D.C. anytime soon, but I still would like to see them. So you can request a meeting in the district or their state. But all of that is pretty straightforward, and that gets done, again, through the website. So what do you say? As we mentioned, we want to really highlight, as Tip O'Neill used to say, all politics is local. So we want to make sure you have your name and your hometown, also so they can, know how to get back in touch with you. We have on the right-hand side here provided a template to try to give you some unification around and alignment around what are we trying to get here, right? So we're talking about trying to get money for both PR, MRP, and CDMRP. So that language is in there and is something that you can keep. Wouldn't suggest that you make any changes to that, because we want all of these messages to be consistent as far as what we want. But what's really important after that is that, and we leave this open to you, is that you share your personal story. I was, had the honor and privilege of talking to a number of families in San Diego and learned a lot. And, members of Congress and their staff, they could talk to anywhere from 20 to 30 people on a healthcare topic a week. And so how do you break through some of that clutter? How do you distinguish ourselves from other, worthy and important causes? There was a lot of things that I heard from people about myotonic dystrophy and just how challenging a journey folks are on. And I think to the extent you're comfortable, lay out, the good, the bad, the hard parts that you live with, for folks who have talked to a number of veterans and even somebody who mentioned even law enforcement stories about folks that literally had difficulty when they became aware that they couldn't, hold the trigger finger. Literally talked to an advocate from Utah who was in the Navy, and it was with Iraq and was, deployed in a combat situation and literally had a problem with his gun in combat. Thankfully, he was okay. He was able to survive the experience, but one of his colleagues, one of his brothers in arms said, hey, why don't you keep that gun in its holster? And he was like, look, I'm a big, strong guy. I don't understand that's happened. That's the kind of story that is going to stick in the mind of a member of Congress and their staff, and they're going to take that forward. So, make sure that you're thinking about, things that maybe to you are embarrassing, or maybe you just have taken them as just part of your everyday life. They're not so, everyday to a person in Congress, and it is the kind of thing that's going to help us build that awareness and ultimately give them a reason to do some of the extraordinary things we want them to do in research. So again, we've got our PRMRP, request that you can see. There's language in there about CDMRP. There's an inconsistency with what I have on the slide that says 5 billion versus 10. It's 10. We're always going to go to the higher number. And then most important, always thank them for their, their interest and their support, and let them know that, we expect to hear back from them, and we're going to follow up with them. So then as we think this forward, right? So I'm giving you this is the immediate action item coming out of International Myotonic Dystrophy Awareness Day, right? This is what we want you to do. We want you to go to those websites, try to do a meeting if you can this month. If not, make a phone call. If not, send an email. The email template is going to be up on myotonic.org, but we're also going to ask if you would like to receive a copy of this letter. You can email me directly, and I will provide everybody with the information about the letter. And then we're also going to provide you with the slides and information around how you can do more research on your own that we talked about as far as how much funding we're seeing at NIH and at CDMRP. Why that's important is we are beginning now the process of building this national grassroots advocacy network. Many of you may be aware that the Myotonic Dystrophy Foundation, the board, and others spent a lot of time on a new strategic plan. It's a really, really important and powerful plan that focuses in on efforts to build community, improve care, and ultimately get treatments through the FDA process and find a cure. And in part of that, there's a really strong advocacy pillar in this. And so the first step in that strategic plan and charge was for us to build a national advocacy committee. So we have gone and built one that is getting off the ground this year. We've been doing quarterly conversations and really starting to get a feel for how to go about this. Really making sure that we're reaching people where they are and taking baby steps where necessary and stumbling sometimes in our communication. But the ultimate goal here is to think through about how to structure and build this group. One of our suggested ideas as we go forward is thinking about having state advocacy chairs. Maybe in a place like California or Texas or Florida, we might have to break a state up into parts. But idea is building our volunteer grassroots advocacy capability so that we have people in each state who is the go-to person for advocacy, that helps recruit new advocates, is a resource for folks who are getting started, who may not understand what to do, can be mentors and guides. That's going to take some time, but we're getting there. And so how do we do that? Well, we start to get everybody's email address that wants to be a part of this. And we start to get a cadence for how often do you want to hear from me, from the board, from our committee about activities happening in Washington, maybe of interest and of importance to us as we're working towards our advocacy goals. And then also, and equally important, is they will then be that will become our vehicle to communicate with you when we know, for example, that the Appropriations Committee is about to vote on something of importance to our community. And then we provide you with those sample letters and instructions and a timeline of when we need folks to act, and then a way for you to come back and communicate with us when you've gotten feedback from your senators and representatives about what we've asked. So it's super important, but it's going to grow here. And then I think the plan will be for next year to do another virtual advocacy week, which we did last March. We'll provide webinar trainings again in advance of that, and then make sure folks are up to speed on what are we asking Congress to do. But that's going to be your time to go to your senators and representatives and set up virtual meetings. If you're in DC, you're certainly welcome to do in person, or if you want to meet with them, in the state or congressional district. So there's any number of options. Again, it's really up to you where you feel best and most comfortable sharing your voice and your story. But that'll be important. And then what we're trying to think about, we've had some interest, and we've done some sort of beta testing, if you will, of some nighttime half-hour advocacy calls that I've been hosting with folks around the country. And we're just trying to find a real low-level, very comfortable, environment for folks to ask questions, any question, that you have. It's a very safe place to ask questions. We want to help use these as a way to build knowledge and comfort and energy around our advocacy network. And so since we're, a relatively small, rare disease, I think it allows us the opportunity to have more intimate conversations around these topics. And I think another area that's important, and I heard from a number of folks again in San Diego about issues that aren't on this list and things that people think should be more important. This is another way to help bubble to the surface, areas where we might see a gap in some important policy that we think needs to be changed. In many cases, some of those are being addressed, and we can communicate that maybe more effectively in partnerships that we're having with the National Organization for Rare Diseases, more commonly called NORD, and then the Every Life Foundation, which are two really important national organizations that bring many, many of the rare disease patient advocacy groups together, where we speak a collective voice on areas around Social Security, other disability policies, broader issues around health insurance coverage, ones that, together we have a broader and bigger lift. The things that I talked about today are areas where I think, and the board has recognized, but for the myotonic dystrophy stepping forward and having our voice heard, are areas that won't happen without us. So that's why when we focus on the advocacy, it's that sort of focus today. It's not that these other issues aren't important, it's that there are other ways that we're addressing those. But again, as we grow in our grassroots advocacy, we can make those areas and opportunities that we're involved in a bit more higher focus or higher level for folks to see. So those are just a couple of the things that we really wanted to lay before everybody today, and really invite your questions, your comments, either today after I'm finished in a minute, or as we go forward, in emails or other venues. I'd love to hear from you. So that concludes today's webinar presentation from me. Below here, you'll see my contact information. So it's Kevin Brennan, and I represent an organization that is called Bluebird Strategies. And I have been working with myotonic dystrophy for 8 years now in the work that we're doing collectively to try to change awareness in Washington and across the country and around the world, and ultimately to get the sense of energy and urgency that we have, in Congress. So I will then take a pause here, and I'm going to pull up the question bar. So forgive me while I just, okay. So I think I've got my first question here. Okay, somebody says here, if we are in DC, can we call you to help or even join us in meetings with our representatives? That would be awesome. Please do. I can't guarantee I can do everything, but if you are ever in town and wanted to get coffee, or you are ready to do a meeting, I am absolutely ready to be your wingman. So let me know. Again, you'll have my email address. I'm encouraging folks to send their notes so we can start to build this email network that we'll be starting to communicate with. But yes, the answer there is yes.
Kevin, would you like me to read them out loud? Would that be helpful?
That would. I'm sorry that I'm so inept here.
No problem. I'll just take this moment to remind people, if you have a question for Kevin, to just type it into the chat and that'll pop up. So we should be, hopefully we'll be able to see the question. Just type it right into the chat. So Kevin, what I see here is, what should people do if they are outside of the US?
As far as folks outside of the US, unfortunately, I don't know that there's any direct advocacy that would be beneficial as far as, Congress is going to pay attention to folks who are US citizens who are voting in the United States. But I do think, if there's opportunities for you and you're in the country where you live, I spoke to some folks from Canada when I was in San Diego who were talking about things that they wanted to do as far as some opportunities to address improvements in the healthcare system directly related to, folks with myotonic dystrophy. I had some ideas. There is a certain commonality among, democracies that you might have a parliamentary system versus the system that we have here, which is different. But at the end of the day, you're selling ideas. You're identifying problems which may have a public solution. And so then you're petitioning your elected officials and representatives to help solve that. So while I'm not an expert in, the various, different healthcare systems that exist, I do have some expertise in at least how to work within a legislative framework to try to achieve an end goal. And I'm happy to talk to folks about that too, if that's helpful. I do think, if you do have a friend or a family member in the United States, you could join them for their meetings or conversations that they're having, and it never hurts to highlight differences between healthcare in the UK for good or for bad versus the United States as a way just to highlight that this is a global effort. So please, there's no reason not to join those conversations if they're happening. But as far as directly engaging or having influence, unfortunately, that's a trickier thing to do if you don't live in the United States.
Thank you. You mentioned that if we're in DC, we can give you a call to visit, which would be great. But if we can't make it to DC, would you be kind enough to review our letters or messages for us before we send them to our senators or our members of the House?
Absolutely. I think it's so important that everybody have as much, focus and attention right now as we can, so that, if I'm doing all this, what I want to do is over time, you get so good at these things that then you're fielding calls and taking emails from folks in your state, and they're going to you as the resource, and maybe you become that person who is the state chair. But that's how we grow, right? So it's more of sort of a, as they say, train the trainer. So by looking at your letters, I have an expectation that you folks are going to become experts in this process too. So I would love to do that for everybody who's interested in being an advocate.
Wonderful, thank you. The next question is about state level engagement. So the question comes from someone who's wondering if it has to be federal that we make all of these connections with our senators and members of the House, or is there something that can be done at the state level that would also be influential in helping us achieve additional funding for research?
So that's a great question. It kind of depends on your state, and I'm happy, to also have this conversation offline so I can get more information from the person asking the question. But, I know, for example, that, if you're in California, there's a considerable amount of state funding that goes into new research. I know that there's been, initiatives around stem cells and others, but I know that there is, state funding that supports, academic research there. So that would be one area, but I can't speak to all 50 states as to how much and how little they may do that. So it's really more of identifying, if you can, if there's a gap in some fashion, research or otherwise, where we think that there's an opportunity for a state to step in and do something better. There is also, if you look at NORD and Every Life, there's a number of different broader work happening at the state level. And I'll give you one example. I think that, we're talking today about research, and I was saying how excited I was to see all of the companies that were talking about products that could be in the next, 3 to 5 years coming to market. We know generally that in the rare disease space, and given that these are likely, complex biological therapies that have to be injected or infused, they're going to be more expensive. And so there's going to be challenges around private and public insurance coverage. And so we're building this advocacy network for the future, because we know that when those happen, our advocacy priorities are going to shift. And we're going to add onto that some of the work that's happening on trying to knock down barriers to coverage. So prior authorization, step therapy is something that happens in some cases where they try to put you on a lower level of therapy and prove that that doesn't work. You have to fail that, as if you will, and then move to the more expensive, more complex therapy. Working with groups, we've tried to knock those obstacles out of the way of patients. So you'll be able to see that there are groups that are engaged on those at the state level, because state health insurance is complex, and a lot of that regulation happens on the state level. As we saw with the Affordable Care Act or Obamacare, there's a lot of opportunities for the federal government to, and they do regulate multi-state plans if you get that from a large self-funded employer, or if you're Medicare eligibility, or even Medicaid. So let me know if there's anything more I could do, if you want to just drop me a note about that. But there is things you can do on the state level. We are not specifically, organized around a state-specific effort, but I know that over time that's going to change as we get treatments.
Thank you. Someone's asking if perhaps there are other ways to demand more research for myotonic dystrophy. Unfortunately, this attendee has lost both their sister and father to myotonic dystrophy and wants to be sure that as much research as possible is getting done. So you mentioned PRMRP and CDMRP as ways that the foundation is attempting to achieve additional research dollars. Are there other ways that we can ask for more research for myotonic dystrophy?
Yeah, there is. One area that the foundation is making important inroads is so I've talked to you about sort of the push to get more research dollars, right? So there's another side of this whole equation, and it is getting more researchers interested in getting involved in myotonic dystrophy research, right? So the money's there. Oftentimes what we have to do is the research community has to step forward with, proposals to study different elements of a particular disease or condition. And so I know we've been talking to folks about how to make sure that more people, so let's say you're mid-career and you're a researcher and you're interested in muscle cell research, how do we pull those folks in to get more deeply interested in myotonic dystrophy? So I think part of the READY initiative is going to be focused on that, getting researchers who are involved in something that's maybe, tangential to us, that could be more deeply engaged, but then also bringing new researchers who are just starting their careers and getting them more interested in applying for grants that would be focused on myotonic dystrophy research. So I don't see that we're going to change the number of in the immediate future beyond the READY initiative, creating new buckets of funding, but we're trying to work kind of both ends. We're getting NIH to do more in that area, PRMRP to do more, but we also need to have more folks step forward and apply for, grants, so that they're competing and pulling more dollars into the broader myotonic dystrophy research bucket. And that's something that we're, as an organization, actively engaged in. And we, Tanya and I had a really wonderful conversation with all of the amazing and dedicated researchers on the Scientific Advisory Committee in San Diego, who I wish folks could have been there. It's just about the most amazing group of people you'll ever meet, who are working really hard on this research that's going to translate into cures. So we need more of that room. What really hit me was just how small a group that is, and why we need to enlarge it. So it's a harder one, I know, to address as far as the questioner's comment, but it is important. I want folks to know it's something that we care deeply about and are trying to change. So that's the sort of long answer there.
Thank you. So today is International Myotonic Dystrophy Awareness Day. Should we be contacting our representatives today? Is it more important to do it today, or is there a timeline associated with reaching out if we want to achieve the $10 million for the CDMRP that you were talking about, or make sure that PRMRP gets added to the fiscal year budget?
That's a great question. So it is a wonderful opportunity in the time remaining today. I know here on the East Coast, it's almost 4 o'clock, and I know we're almost at the end of the webinar. It's certainly a great opportunity to highlight that today if you have time. But as far as kind of the window of opportunity as it relates to CDMRP and PRMRP requests, and they're both important, you have, I think, within the entire month of September and even into October, if you wanted to try to get a message or a meeting. If you've got a good to-do list and you want to check things off quickly, I would say if everybody who has the intention of making a call or sending an email, try to do it by the end of September. If you're saying, I want to do something a bit more, more advanced and I want to do a meeting, it takes a longer time sometimes to get those set up, but send the request, within the next week, and that'll get the ball rolling as far as trying to get that scheduled. But use this day as kind of the pivot point for that. And I think you can always in your message highlight the fact that we're launching this effort on International Myotonic Dystrophy Awareness Day. And I think that's just an important sort of tentpole to place there. But hopefully that makes sense.
Definitely. One other question. Someone writes that they have not been involved in advocacy like this before, and they are very nervous about reaching out to their representatives and worried too that they might not include the right language in their message. What can you share with us to reassure all of the advocates at every level that we need to go ahead and just write that message? And if there's something very specific it should include, no matter what else we say, what might that be?
That is maybe the best question. So I'm going to give a hopefully not too long-winded a response, but when I was about 22 years old and I was trying to break into Capitol Hill as a staffer, I was absolutely afraid of my own shadow. And my father drove me over one day because he said, look, you haven't done anything to get a job over there and you keep talking about it. And I had a stack of resumes in my hand and I marched into the Cannon House office building and I saw the first receptionist at the first desk and my knees almost gave out from under me. I was so scared. And I handed her a resume and said, if you guys have an open job, this would be great. I'd love to talk to you. And then I ran out the door. I was only able to summon the courage to do that 2 more times. And then I took every one of those resumes and threw them in the garbage, grabbed a copy of the Washington Post and sat under a tree for 2 hours until my father came and picked me up again. I can appreciate with every fiber of my being just how hard it is to go in and talk to a member of Congress or their staff. But what's important to know is we are not approaching this from a controversial position, right? There are Democrats who get myotonic dystrophy. There are Republicans who get it. There are independents. There are people who don't vote. It is our right to talk to them, and they are not inclined to be mean to people who are coming from a patient advocacy perspective. That's not to say that there aren't other special interests who have, may offend them from some policy position that they've taken, whether they are liberal or conservative. And I know in this day and age, things are a little bit crazy as it comes to sort of the lack of sort of comedy between folks and the ability to be polite. But there's really no wrong answers that you can do as long as you follow the golden rule and you are kind and you are polite and you simply ask them on behalf of your position as a constituent to do something for you. The worst they can do is ignore you or say they can't help you. But they're not going to be, to my knowledge anyway, mean or cruel to you or belittle you. And if they do, we're only 6 weeks, 8 weeks away from an election, and they'll be so much the poorer for the fact that you as a constituent who's going to vote, they're going to ask you for something and they're going to ask you for your vote, and you can decide not to vote for them based on the fact that they treat you poorly. If by chance, if you're meeting with them or talking to them and they ask you a question that you don't have an answer to, and if that's the thing that keeps you up at night or nervous, there's a real answer, easy answer to that. It is, you know what, I don't know the answer to that. I'm going to go back to talk to Kevin or talk to Tanya or somebody else that I know who may know the answer. And if it's okay with you, I'll get back to you on that. So you don't have to come into this feeling that you have to suddenly be an expert on what a markup is or when the president's going to submit their budget. You only have to be an expert on what you live every day, either living with myotonic dystrophy or caring for somebody with myotonic dystrophy or trying to advance the science and clinical care around myotonic dystrophy. And then if they don't want to support you in our efforts to get more research funding, that's on them. They should give you a reason why they won't. And we should be polite in accepting that one way or the other. Doesn't mean we accept it and then we stop asking them that same favor, but it means that we see where they are and we get to make decisions on how we support or don't support that individual going forward. But if you ever have a circumstance where somebody comes at you and you've been polite and respectful and have asked for their help and they've been unkind to you, well, let me know. But I'd be real surprised if anybody does that. Like I said, the worst thing that can happen is that they won't be timely in their response. They will ignore you, and they're going to require us to have more of a presence and to be what I'd say politely persistent in our pursuit of their attention and their support. But I hope that helps make this process a little less scary, because we all have had a situation, even me, when it comes to Congress, where we've been a little bit unsure of ourselves or scared. But I assure you, after that first interaction, most people come away energized and excited. and want to do more.
Thank you. That was great. It looks like we only have one more question, and this comes from someone in the country of Jordan in the Middle East, and they would like to know, they have at least 3 family members in their immediate family affected by the disease. They would like to know how to join the efforts. And I know you, Kevin, you talked about this a little bit if people are outside of the US, but if you could maybe just reiterate that one more time, that would be fantastic.
Yeah, I think, look, if there's anything I can do for folks who are overseas to provide one-on-one guidance as to the particular problem in your country that you're seeking to solve or address in some way, I would be happy to talk to you one-on-one if you want to email me and set up a time to help understand, because I wouldn't know everything there is to know about your situation. I would be happy to do that. Truthfully, if I could be an international traveler my whole life, I love different cultures and I've traveled to many places. So I get as much out of these conversations as you do, because I'd love to learn more about Jordan and what you all are trying to achieve and accomplish there. And it'd be my great honor to talk to you about that. As I mentioned too, if you have relatives, friends in the United States, and if they're planning to do, meetings virtually, that maybe you could join via Zoom or others, feel free to do it. I don't think there's any harm in doing that and letting folks know that this is an international effort and we're bringing together people from all over the world. And look, the research that is advanced in the United States through funding at the National Institutes of Health, that research gets published in peer-reviewed journals that are available to scientists and researchers all around the world. And so as an American, I'm proud that we were able to lead in some small way in that fashion, but certainly would love to talk to folks from overseas who have an interest in trying to make some changes in their home countries.
We have one final question. Sorry, we just popped up.
No, this is great. I love it.
Fantastic. So it's an excellent question. Is it okay to send a letter that you generated, or do we need to generate our own letter?
Great question. So years ago, when I was what was called a legislative correspondent on the Hill, and I can remember you'd get like petitions that would just be signatures, names, addresses of people. And I always assumed that, somebody was intercepting people on the way to a grocery store and just saying, hey, I need you to sign this. And nobody had a clue what they were signing. And you sort of weighted all the communications that came into an office. And that was one where you just sort of like, I can't even trust that these people know what they even signed. So it is important that we not be seen as just having sort of, mimeographed letters that are all the same and everybody gets. That being said, it is important that we be consistent in what we're asking. So I think it's perfectly appropriate and important that you keep largely what's in that first paragraph around what we're trying to get Congress to do. But then what distinguishes that letter and what shows them that there's heart and soul in that letter is your story. So that's where we leave as much room as you want to talk about your journey with myotonic dystrophy. And so we really encourage folks to personalize that section of the letter. So as long as we balance those things out, it becomes a very potent communication to our elected representatives.
Thank you, Kevin. I think that was it. That was the final question.
Awesome. Well, thank you guys for all the great questions. Thank you for taking some time out today to, learn a little bit about what we're doing. I hope everybody that's interested sends me your email address so we can begin to build this network. And then I'll keep you posted as we start to communicate with this growing group of national and international advocates and start to set up some of these calls, these monthly calls that I talked about, and really, really value your feedback. Again, we really want to meet you guys where you are and tell us if there's other ways and things that we could be doing to help communicate and make this less a scary process, demystify it, really help you find your voice and start to build some, architecture around what this grassroots network looks like and how people will really start to step up as leaders within this in your states. So thank you all, and I hope everybody has a wonderful International Myotonic Dystrophy Awareness Day.